We're going to have a great training today talking about the TL junction, primarily T12. What an incredibly important vertebra. I was taught 30-something years ago, Tory, the most common vertebra in the spine to subluxate is T12. Why? Because it blows out the back on like everybody. Yes, I know 8 out of 10 kids are getting their neck twisted at birth. That would be certainly significant. But as far as you get going in life and the daily activities of life, the flexing, the bending, the twisting, the sitting, okay, that T12 blows right out the back. Why? Because the rib cage is relatively solid, so everything hinges on T12. This whole upper body, this whole big mechanism hinges on a vertebra that's not even 2 inches wide. And then the whole thing hinges on L5, which is not even 2 inches wide. Look at the leverage on those vertebrae. Look at the weight that's on those vertebrae as compared to, let's say, a C7. So I absolutely agree with that. It blows right out the back. Remember now, it's narrower. We have transitional facets. We don't have very big transverse processes. The spinal canal is actually a bit narrower, but we have the cauda equina, the lumbar enlargement, and all the nerves come out like the tail on a horse. I mean, this is a nerve center maximus right here, okay? Lumbar plexus, cervical plexus, okay? There are very few adjustments that feel as good as a T12, and that's adjusted well. I mean, it is electrifying. It is relaxing, okay? It takes off the body, okay? Because one T12 is subluxated, which it probably is on you right now. When's the last time you had your T12 really adjusted clean? Like T12, not T10, like everybody says, like everybody else. In other words, they say T12, but when you feel their hand, they're way up here. Especially if they're using a double thenar, that's the sellout. There's no T12 with a double thenar that's done well because you can't adjust your muscles that thick. You have to get in the valley. You have to get on that. I'll go over that in just a minute here. So how many of you listening, watching, how long has it been since you had a really good T12 adjustment? 5, 4, 3, 2, 1, 12. Way down there, not here. And call it T12, just like not up here and calling it C7, okay? It's a great adjustment, so let's dig into being able to do this. Now, interesting point I want to make here. Think about this. If you went to any dentist, you would expect that any dentist could work on any tooth in your mouth, right? They could work on any tooth, front tooth, molar. They can work on any tooth in your mouth. It isn't just that they can work on the front 4 teeth and one each of the back teeth. You get the idea? They can work on any tooth in your mouth. Wouldn't it make sense that a chiropractor could work on every vertebra in the spine, not just the easy ones? Does that not make sense? That a chiropractor would be able to work on every vertebra and they would put the time, effort, and energy in to be able to adjust every vertebra? C7, T4, T12, L1, L5, L3, okay? Instead of just C2 and T7, right? So the real high-performance pro chiropractor can adjust every vertebra in the spine, especially the difficult ones, because it just happens to be that the difficult ones are really the ones that will change people's lives more than anything because of the neurological and biomechanical control there. Okay, so let's take a look at this T12 and go over some of the biomechanics of this. Make sure my notes are on point. Yes. Okay. Good, 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 good. All right, I'm going to make a couple quick comments here about the table. There is no adjusting a T12 on the wrong table, okay? We have to be able to get the right angle. And to do that, we have to have the right table. So I will go over this table again. All right. Now this looks like a typical zenith table. It is not. Okay. This was a tippy table and we got rid of that mechanism. Okay. Okay. And now it's stationary, but here's what makes the table special. All right. This is a zenith with what we call the TR1 modifications, which means what? We have a bigger foot plate in the front and a bigger foot plate in the back. We don't just have legs, we've got a wide foot plate. So this table is much more stable. Normal zeniths, when people go to get on it, they can tip them. Okay. All right. Then we go with the thicker foam the whole way. And of course, we have the upgraded material. This material feels so good. It's not slick vinyl, it's much more leathery. Okay. And we have the super soft foam here for our upper thoracic adjustments. And of course, we have the flex away thoracic piece, one of the greatest inventions of all time. Okay, this is the secret right here. There is no adjusting a T12 on a regular table. It has to give. You have to, you see, remember now, you have to give it room for the vertebra to move. Okay, you can't, if we have a rigid table, I lock this, okay, and I push down with 10, the table's pushing back with 10. How can the vertebra move anywhere? The only give has to come from the human body, and we can't have that. So we have to have the give and the vertebra go through the person, okay? Like so. The wide pelvic piece, all that. And there's a certain place we have that makes the TR1, like you see. Now, of course, we got the knee chest table, but I will do a little knee chest video separately from this. So we have to have the correct table. And when we have our patient prone, and we'll get someone here in just a minute, okay, we got to be very conscious of what we're out to do. Now, I'm going to make mention of a term here you probably have never heard before, even though you should have in chiropractic. The problem here, as we get to the lower thoracics and into the upper lumbar, adjusting prone, is what people do is they knock it inferior. And that's what hurts people. That's what stings people. That's what people don't like. So that's why the chiropractor does not get into this zone. They're afraid to get down there. They'll push in the middle of people's backs, but they won't get down here. And here's what it looks like when I get close and show you, okay? What's actually happening there, all right, is if you push, okay, and you push down like this on the spinous, it's very easy to have it pushed back like that. See how it's going to push sort of down and back. See that? Because the spinous is sticking up this way a little bit. So when I push on it, it wants to go that way. See that? It wants to push down and back like that. So to adjust this well, you have to get underneath this and you have to literally lift this up and then push it down through the plane line of the disc. And you see the angle right there for that. See here, it's easy. You can push straight down. But if you push straight down in an area where there's this little bit of lordosis, okay, like this, okay, if you push straight down, you will push and you will jam the facets down. See that? It will jam them down and back. All right? It will jam them down and back. Okay? And that's what twangs people. So the angle here, you have to get tremendous lift. 5, 4, 3, 2, 1. Here's 12 right here. You have to get tremendous lift and then push down. You cannot just push down on this thing because you'll just jam it back like that and it will hurt. Okay? So we have to have them set upright and we have to be able to get lift. And you'll see how we do that here when we get that set up. Okay? So I cannot stress enough. You cannot knock it inferior by basically jamming the vertebrae back like that when it needs to go up and forward. Okay? Because the spinous is sitting there like this. And if you push down on it, it goes this way. And that's bad. And up here at T4, it's like this. Okay? And it's much easier to adjust. and it's very difficult to twang somebody up here on, say, a T4 unless it's tender. But down here, because there's no ribs now, we're outside of the protection of the rib cage, so it wants to extend. So very few people can do this, okay, and really get down on T12, okay, not T10. People say, oh, I adjust your T12, and I feel their hand go on, and it's way up above it, because they know if they get, especially if you have the wrong contact. And once again, remember now, let me show you this, okay? The way this has to be adjusted is, you see here, there's going to be a V of muscles. So you see how the bottom of my hand is shaped like a V? There's the V. And that V fits in the V of the paraspinal muscles perfectly. It fits right in there, which I'll show you in a second. So this has to be adjusted with a soft, okay? And there it is right there. It's this pad part right here. In fact, I call that a spinous holder. See that? We put a little dent in there for you, okay? There's a spinous holder here, okay? Right? So we have to get in with the V so we can get past the muscle onto the vertebra, so our force will go straight through and we can make this easy. This is a very easy adjustment once you know how to do it, okay? It has to be a single contact, soft pad, lift, and in we go, all right? Okay, so let's do some demonstrations here. Now, ladies and gentlemen, we always recommend we use face paper sheets. We never use a roll. Why? Because I don't want to be leaning over and having to fix the roll 140 times in a day, okay? So we use the sheets. Now, the sheets usually already have the slice in them. Here in my office, it's perfectly fine to use paper towels because they work great also as we put the slice in there, okay? So let's get the model spine out of the way and let's have her jump onto the table. Now, here's how we do this. One, we always make sure this is flexing. Now, by the way, on the table setup, and I have a video on the setup for our clients, this has to be all the way up headward. We want about 2-inch gap here. And then, of course, this tension has to be set properly. And there's a way to set this. So we have just the right amount of give, not too much. Otherwise, it'll extend too much. It won't be comfortable for her. And it cannot be too rigid, okay? All right, so let's have her jump on down. So jump on down you go. And as she jumps down, I'm going to put my hand here like this. That way her shoulder does not go up onto the headpiece. These people, many times, their shoulders will be way up on the headpiece. So I just put my hand here so I don't even have to say anything. And now she's on here perfectly. And I will even sort of set the table by just doing this a little bit just to make sure. Now here we are. Let's take a look at what we've got here. So we see how her spine is laying on the table. We see we got just a nice slight kyphosis here. So if we look at where T12 is, see how it's angled back a little bit? It's not flat, it's angled back. So if you push straight down on it, you're gonna jam it back. In fact, I will do something here, Brittany, and just tell me if you like the way this feels. You see how I'm kind of jamming it?
Yeah.
It's jamming it. She doesn't like that. Okay, so that is why the line of drive here, and let me get my pointer. Okay, I love this thing. Okay, the line of drive has to be this way. You cannot push straight down. So here's the line of drive here, line of drive here, line of drive here. So when we get set up, it's going to be our footwork that's going to be important here. Now, it's very easy to find T12 because we got these broad lumbar vertebrae, then boom, we find this hole, and there's our little pointy T12 right there. T12, 1, 2, 3, 4, and then we're down here on number 5, okay? All right, so number 12, like so. So I'm just going to do it, and then I'm going to explain a few things, okay? Now, when I walk up to a patient like this and I put my hands here, I could tell my pinky knuckle is at the waistline and I'm up here. It's almost like it's like a piano. It's like a 24-key piano. And just like a piano player knows where they're playing, okay, I like know where I'm at, okay? Like I can just tell where I'm at in the spine, all right? So here's our T12, and just watch, I'm going to do this and then I'll explain it. Okay. All right. Now, first thing is this. See how I'm standing? My forefoot is at the level of the vertebra. That way, I'm guaranteed with my stabilization hand, see the angle here? I'm guaranteed to get that forward lift. Okay, just like so. And then again, we have the soft pad. But here's something that's very important. An amateur chiropractor will kind of go like this. They'll try to grab stuff with their pisiform. That's how you know they don't know what they're doing. Watch how my hand goes on. My hand goes on fingertips first. She can't even tell where my pisiform is. She doesn't even know it's there. She doesn't even know it's there. I'm just touching her back. She's totally relaxed. If I start to come in like this, she hates it already. She hates it. Okay? She really hates that. Okay? All right? So my fingertips touch the pads. And then what happens is, as I come down and in, my pisiform comes in like this. See? So how you approach the person. Here, look at my angle. Here, my angle. Here, my angle. Okay, with the stabilization. But the fingertips come in. I know where T12 is. I can feel, this is like another thumb tip for me. I can feel with it like a thumb tip. Okay? And I know I'm where I need to be. And look at my body, my xiphoid, and that force is going to go through my hands here. And what you'll see from the other view, okay, is this is perfectly lined up with her spine, just like so. Okay, it's not here, and I'm not over here like this. This is the hammer hand, as it's called. Okay, so this directs that force this way. Okay, all right. Fingertips in on the contact, gentle. I'm barely touching with my pisiform. I see you got to sneak up on the vertebra, especially if it's tender. You can't just go, there it is, and you're feeling it, and then you stand here and you pause, and she hates it, okay, because she knows it's coming, and she doesn't know how to breathe. Okay, see, the high-end chiropractic works like this. As soon as she lays down, I know she's going to take a breath in. Because on the way down, she held her breath, because we all do. She kind of held her breath, so as soon as she lays down, she's going to take a breath in. So she lays down, and as she takes the breath in, she's up, and I'm already coming down with her. Boom. And then watch this. Then she's going to breathe in again, because I just compressed the air. And let's say if I was going to do T4, boom. Okay? And it is perfect. So the high performance chiropractor is aware of the person's breathing. The amateur is unaware of breathing, and you're doing what you want to do because you want to do it, and they're under here suffering. Okay? Yeah, but things move and people seem to like it. Yeah. But it could move better and more people would like it. Okay? As you become more conscious of what the person is going through as they're on the receiving end of your adjustments. So, into position, I know they're breathing. Remember now, I've already done my analysis. I've already reviewed an x-ray. I've already, ran an instrument. I know where I need to do the work. And it might be a T7, and it might be a T4, it might be a T3, and of course, it could easily be a T12. All right? So after I've done that, when we go to work, okay, and my recommendation is you do all your big analysis, and then you do a series of adjustments on the main ones, okay, that you found, and then you can recheck. Do I need to recheck every time? Why would I do that? Okay, I got 17 people waiting. I can't do that. The needs of the many outweigh the needs of the one. Okay, an 85% result with 140 people a day is better than a 94% result with 60 people a day. Okay, just some personal thoughts there. All right. So again, foot's lined up, soft pisiform, stabilization, and we're going to go, see my thing, I'm going to go up and over with my legs, and then down and in. I'm pushing this way. And watch this, I'm not tricepping it. I'm not going like this. Okay, just watch how slow this is in real time. Chiropractors are all jabby. They sit here and they wait, and then they go, twing. It's horrible. Get the idea? It should be slow. Okay? Okay? Slow. Slower than her pulse. Because if I'm moving faster than her pulse and I raise her pulse, she thinks she was rushed. But if I come up here, okay, and I'm nice and smooth, I count down to say my T4, easy, boom. And I come down here, T12, boom, okay, all right. And I go, that was perfect for today. Let's have a seat in the chair. Look at that. It was like 14 seconds and she feels relaxed and like she was able to enjoy it. So important. See, we can obliterate the fabric of space and time by moving slow. A common problem in chiropractic, and again, this is what people say when they don't know what they're doing. The CA or whoever say, I need to speed up or you need to speed up. No, you need to actually move slower and do less. So when you know what you're doing, especially in the world of practice management, you train the CAs to say to the doctor, do less. Do less. Not go faster. It's do less. Move less. Talk less. It's just do less. Go slower and do less. Okay? So that's the name of the game. Once again, patients in position, beautiful face paper sheet, flexing, gentle contact, fingertips first. Look where my body weight is. It's all on my right foot because I got to go this way. And then, by the way, notice what happens here. All my weight's now on the back foot because I've got to push that way. And it's comfortable. See, you can practice adjustments with good biomechanics, and it's comfortable for the person. With adjustments that aren't that good, you can't sit there and just hammer on somebody and practice. But with good angles, we can sit here and I can go 1, 2, 3, 1, 2, 3. See that? And she's not like screaming and getting sore. All right. So very, very good. All right. Quick recap. We have to be able to adjust all vertebra. We have to have a table that allows us to do that. The soft upper piece makes these easier. The flexing piece, watch the flexing piece. See that? If that doesn't move down, nothing happens. But she will even tell you that this is still nothing like the knee chest table, where there's nothing underneath the tummy. Things can really move easily, and you can really fix some things on that table. I'll make another video for that. Okay? So there it is, being able to adjust the TL junction. We've got to get up and over, down and in, single hand contact in the V, very, very soft, very, very gentle, very, very smooth, very, very easy, very, very comfortable. Great job.